One of the reasons I think outreach is so important is the fact that it focuses on the population of homeless that, in my opinion, is the most vulnerable, those that referred to as the unsheltered homeless. Our Dr. Megas, our medical director, estimates that approximately 90% of the unsheltered homeless are folks who have experienced severe trauma. So street outreach really provides a venue for us to try to establish relationships with that population. I think we begin the process of building a trusting relationship by, first off, taking what I refer to as survival kits out to folks who are staying outside and under the bridges, socks, shoes, sleeping bags. And I really see those items not only to benefit them physically, but also it gives us an opportunity to begin entering into a relationship with folks that are on the street. Oftentimes they really lack trust, have been victimized and hurt in other relationships, so it really takes a while to build a relationship with the unsheltered homeless. I think there's a number of reasons why people are staying outside, and again, I think it is hard for many folks to understand that, but like I say, there's a number of reasons. I think one of the reasons is the fact that some folks who have a mental health condition are just simply unable to function in that type of setting. And for example, I think the person who's schizophrenic and who has symptoms of paranoia and suspicion, to ask that person to sleep in a dormitory setting with maybe 70 or 80 men or women, I think is really asking the impossible. So those folks are oftentimes much more comfortable staying outside in a tent or under a bridge. Another reason, I think, we see a number of couples who are unsheltered homeless. And those are folks who would really rather stay together than to separate and go to different shelters. Also, the reality that the shelters are oftentimes crowded, and there is occasional violence and theft that occurs. So oftentimes people are more comfortable staying outside. Also, I feel the perception of the shelter has a lot to do with why people don't enter into it. We've run across folks who have never been to either the men's or the women's shelters, but because word on the street is that they may not be safe or comfortable, that in itself is enough to keep people out on the street. I would like to define our philosophy basically as what I would refer to as compassionate relationships. I think it's very important with the population that we serve on the street that we really have to meet people where they're at. And by that I mean in a really non-judgmental, compassionate way. I guess I would best describe that philosophy as trying to walk with people instead of doing for people. And oftentimes that's really contrary to the existing social service structure. Just letting people know that whatever they decide to do, whether it's staying outside or entering into a program, that the important thing is that they are important and valuable as a person, that we'll continue to be in relationship with them no matter what they might decide to do. And our relationship isn't based on what they decide to do. That we will continue to come and be there for them as much as we can. So when they are ready to make some changes, they feel comfortable coming to us if they need assistance with that. I like to refer to them as kind of, we see these little miracles that occur on the street. And I guess I think of a gentleman that actually lived over by the South Marginal off by the railroad tracks, who had been homeless many, many, many years. He was living literally in a garbage dump when we first started visiting him, and we visited him for quite some time. Well, eventually we were able to intervene and get him hospitalized because he was severely mentally ill. He was hospitalized for an extended period, and then from there entered into one of the permanent supportive housing buildings, where he has continued to live. It's been now, I'd say, about 2.5 years. Since that time, he's been able to re-engage with his family. They come to visit him every couple of weeks, and he spends holidays with them. So to me, that's just one example of many we've seen over the years on Street Outreach.